And we're back. Bits and Bytes podcast. We're excited to be here again. This is episode
17.
I just wanted to see you kind of like stroking over there.
Yeah.
Quick.
Yes, let's see out there.
Yep. 17, episode 17. It's crazy. We are approaching the number 20. That's awesome. And it's an exciting time here as we're doing these. We have a special couple guests with us today, one from Byteworks and one from GHA. So just to level set everything, Bits and Bytes podcast, we created this so that we could bring on like-minded folks, industry experts, and share what's going on in the industry, because we find that peers grow and lead better from each other. And as we, dive into similar problems, chances are there's similar problems with other folks as well. Thank you for being here today, guys. We're really excited. I'm Matt Scott with my co-host,
Joey Wensler. It's an absolute honor to have the Georgia Hospital Association CIO, Stephen McWilliams, with us on the show. And of course, I would be remiss if I did not mention the one and only Michael Alshouse from Byteworks, LLC.
Thanks, guys. Thanks for being here today. Today, we're going to dig into some challenges in hospitals and the healthcare industry relating to IT. So before we get kind of into the meat of everything, Stephen, thanks for being here.
Thank you both for inviting me. And always looking forward to having conversations around our hospitals in the state because, healthy hospitals create healthy communities. And one day we may be a patient. And so we're going to want to have a hospital available for us during that crisis. So thank you again.
Yep, absolutely. Very relatable to us. And, while we're getting ready, Stephen, would you mind, maybe giving us a little bit of your background and, who you are just for the audience? I know we've had the pleasure to get to know you, maybe just a little recap of yourself just for the audience.
So, early on, I knew that technology that was interesting to me. I was very curious about technology. And so early on, I would tinker with things. And so when the opportunity came up to go to school and learn about different things, I thought because I love technology, maybe I should keep that as my hobby and I go and focus on something else. So I actually went to school for my undergrad for a completely different thing. And while on that journey, I realized it doesn't matter if you're forced to do something that you love. Because you love it, it will never be really a forced thing. It will be you having a good time. And so when I started my master's program, I did focus on the technology aspect. And so that was my opportunity to prepare for opportunities that came my way. And so I actually started off in higher education. I actually started off at a university. I worked in the IT department and worked my way through the ranks there. And then when the opportunity came to come to Georgia at the Georgia Hospital Association, I thought it was a great way for me to continue to make a positive impact in the community. And so I've been at the Georgia Hospital Association for a little over 10 years at this point. Time flies. And so I've held a couple of different roles there. Right now, I'm currently the VP CIO of the organization. And so what that means is I'm over the operations and strategy. Our organization is focused on serving the over 150 hospital members in the state. And so we do advocacy. We're an advocacy group. And so what that means is we go and speak on behalf of our hospitals, allowing them to speak with one voice so that ultimately they're able to serve their patients. And so, I'm just excited to kind of see what is in the future for healthcare and how technology is going to impact healthcare. And that's what kind of drives me to continue to show up every day. And that's kind of my story.
Yeah, that's awesome. I bet in those 10 years that you've been there, you've seen a massive innovation change and how everything's leveraged. I think that's a really good place to maybe even start. In your perspective, where does technology play within hospitals and the healthcare systems? From your perspective, what are some of the key things that have stood out to you or have the opportunity to really change the game?
Yeah, I would say technology at this point is a thread that permeates the whole hospital healthcare ecosystem. It is part of our experience as patients. And so we have come to rely on technology as new innovations come so that we can work efficiently, so that we can create automations, so that we ultimately reduce errors. We need to address burnout. And so, right now, I think I've been focused a lot on cybersecurity. As all of this new technology comes into play, we have to keep it secure. And the healthcare record is a target that bad actors are going after. And so keeping things secure is very important. Making sure we have the right workforce so that we're able to stand up and maintain all of this technology throughout the hospital is very important as well. And then obviously we want to make sure that the technology that we do deploy in the hospitals ultimately translates into patient care, patient safety. And so that's the challenge now, just making sure the data that we collect, I mean, right now we're talking big data, that's a big topic. AI is a big topic, and making sure that what we're doing as it relates to utilizing this technology to make sure it translates into the healthcare outcomes. You know, it really takes all of us working together and being educated on how can we leverage some of this stuff and learning from one another.